There. Thank God for another day and thank God for another opportunity to come your way with the health arena. There was a prophet in the Bible, and the Bible says that this prophet, God used him to do exploits. There was a mighty event that took place, and God showed his power during that time. But immediately after that, he went into a particular state and he began to cry, God, I want to die. I've had enough. God, I can't stand this anymore. I want to die. Do you know the prophet I'm talking about? And medically, do you know how we describe what happens to him? Well, stay with us. Today we're going to look at similar issues that is happening in our world today. My name is Helen Tettey and I'll be your host for today. Please stay with us. When we come back, I'll introduce my guest and our Were you able to guess or were you able to tell which prophet I'm talking about? Well, you can find me later and give me that answer. In our last episode, we looked at mental health and the issues that occur as a result of disorders in mental health. Today, we want to pick one of the things concerning mental health, and our topic for discussion today is depression. We are so blessed to have a clinical psychologist who is also an apostolic elder. He's been doing this for over 13 years. He currently is a lecturer at the University of Ghana, Lagos. He's happily married and he's a member in the Kanishi Assembly. Dr. Jonathan Odame, you're welcome.
Thank you very much.
Doc, it's a delight to have you here.
Thank you very much.
And in our previous episode, you really threw light on mental health issues. But today we want to zoom in into specifics when it comes to mental health. And one of the things that currently we keep hearing about, depression, and we are depressed and I'm depressed. What is depression?
Yeah, thank you very much. And I'm grateful to be hosted on the show for the second time. And in fact, you are right. Ubia etaka, depression. And I'm happy today. We want to look at what depression is. Into depression, it's depression. It's a from battery. Let me explain it. Because depression, now it's a mental health condition. Now within 2 weeks, you can be diagnosed of having depression. So you have certain symptoms, and these symptoms, is something that you, as a person, you see those symptoms, and people around you also see those symptoms. And it's a mental health condition, which you would lose interest in activities. You may even lose weight. You can't sleep. You even feel like even killing yourself. And all these things, are things that would tell you that you are going through depression. Okay. Now, as a psychologist, you can say that one has to depression. But how will you know? You see, there are some symptoms, more than 20 symptoms. Oh. But at least, say, who have 5 of these symptoms almost every day or within 2 weeks. Now you're having these symptoms now. Then it is telling you that you may be going through depression.
I say, "Meya you kakra." Odofo ye ma kwa ba edeba ene health arena ijumadi so na ene ye kasa afane abrofo ato ne din say depression. Nia oni yen edi say adwuma yen clinical psychologist Dr. Jonathan Odame. Na doctor, depression e retreating. Depression
e should be treating. Who's the bibia retreating? But now because I will eto intimi ntrada. Okay, so let me explain so that you should for better as here. Who's your normal sadness? Who's as a human being, There are ups and downs.
In our
lives. You can lose a relative. You can even lose your job. Your loved one can pass away. But it should have a period of time. Time frame. Maybe after 1 week, after 40 days, after the person has been buried. But depression here, after the incident, you are still in that condition for over like a year and now 2 years. You are always depressed. But because you are depressed, there are some things going on within 2 weeks. It should be persistent on you. Then you are diagnosed as having the depression. Into me, in Chada. Yeah.
Enti nyama bi wo ho a say psychologist no mo hwehwe na ye ka se sa nyama no ekoso a egogofo be se 2 weeks a e do na mugina so de ka se nipa no we nya depression se mete wase ye.
Yes.
Okay. Enti sa nyama no ene nyama ben iti for say be fa paper na wo pen no na ye bo nyama na wo so wo ma wo max se bi wo ho a ana se bi ni ho na we tu ye.
Okay. First of all, one, them sleeping.
Okay.
So, we say, untini enda. And I say, you are always sleeping. We need NJ. Even, Juma Pumbesa Ukwe Juma, Umbesa Ukwa, sorry, and Yama, a manipa energy, Unkwa, dear, we need NJ. Umbesa Ushe TV. Say the program, Tac TV, Ubi, yes, so depression. Debbie. Who better with you? Because I have seen the room film. As we check your program name, and you are also there. You are always sad, or feeling guilty about life. You don't see life as worth living. Who losing weight, and I say who gaining weight. You are always seeing things in a dark way. In fact, you don't want to go out. You are always in your corner. You don't want to engage yourself in anything. You don't even want to have friends. You lose interest in everything. Everything around you is boring for you. Osranopa is only about you. You don't want to eat. You see, then it tells us that you are going through some state, and that state is depression. Now, even another thing also is that people don't even take care of their physical health. It's personal hygiene. Because no matter no matter for that no man ni enje intanopa onjare edume onjare boko pona onitwe say because of arewa about the so na eshim and make us say it's a mental health condition.
Yeah.
And adrena I was a catcher to say hey sorry me could didi sorry me could jare no sa adren part no it's not really working for the person. So the person is having a low mood. That is sadness. The mood is very low self-esteem.
So if I'm understanding you, these things that we are talking about, they persist for a period of time.
Yes.
And if they go on for a period of time, then we can say that the person has depression.
For 2 weeks.
For 2 weeks.
Yes.
So your sleep being affected, your eating habits being affected, then your personal hygiene being affected, then your mood.
Your mood. You can't concentrate. You are withdrawing yourself from people. You lose interest in everything. You feel that you are a failure. You feel that God is punishing you. You think that all bad things happening, you are the cause of it. So even if there is doom so, you think you are the one who caused the doom so.
Oh.
Everything bad is about you. Yes. So all those ideas, and you also have thoughts of killing yourself. Okay. Yeah, in our previous last week now can be about ubia no person on any kunupo having sex. Depression can even lead to that because you are not happy. You don't want to engage in sex because sex is something pleasurable. So when you are going to a depression now, we need to engage to have the sex.
So is everybody who is depressed at the same level, or we have different types and we have different rates of depression?
Oh, in fact, we have types of depression, but the most common one is the major depressive disorder or major depression. That's what is common. But we have even bipolar, which is another form of is a mental condition. The person can be happy today, but at the manic stage or the person can be depressed at the other stage. Then we have dysthymia. I don't know, it's a very, very long form of depression. It can last for like 2 years. Yes. Into most of the time, there are types of the depression, but the major one is the major depression people normally have. And within 2 weeks, Uber hospital, yeah, assess so. But this question is also depression levels are different. Even they are very, very high. Even they are very, very low. Even they are very, very mild. But you as a person, you may not know whether yours is mild or moderate or severe or extreme. And it's a psychologist that's the assess so then we know that with depression is mild. So based on mild, maybe you might need just counseling or psychotherapy. But say you're severe, you're extreme, then maybe you might need medications. But even me as a psychologist, unless I assess you, because I can't just look at your face and just say that your depression is mild.
Right. So even understanding you, there are things that the person will exhibit that will make us think that this person is depressed.
Yes.
But when they come to you, you do an assessment to be able to tell the extent of the depression,
yes,
or the degree of depression.
The depression.
So how do you do this?
Okay,
can you take us through?
Okay, so we use an assessment. So before I start anything, I'll take a history about your condition. So I'll ask you that, within the last 2 weeks, what has been your mood? And we use an instrument. We have what we call the Beck's Depression Inventory. Okay. Yeah, we use that. There are some items on it that I'll ask you. So based on your responses, I would score the questionnaire or the instrument. Then I'll know that this is your level of depression. And there's something nice about this instrument. You can't lie on the instrument because the questions have been asked in different ways along the line. So if you tell me you are not sad, okay, you are not sad. But it's another question that I'll ask.
Are you happy?
Are you happy? Or when was the last time you watched TV or something?
Okay.
And it will come up. And most of the time, on the scale, if you score from 0 to 1, that one it is normal. It's normal. That one everybody can score 0 to 1. If you score 11 to 16 on the scale, it means that you have a mild depression. And if you score from 17 to 20, it means that you're on the borderline. So who need depression? Then when you score 21 to 30, it means that it's moderate depression. That is why a lot of people have issues. Yes, and also when you score from 31 to 40, it means it is severe depression. And sometimes people come to the hospital after the assessment, they score over 40. And that one is there. I'll recommend you to see a doctor for medication. When you score about 40 on the depression scale, it means that man should refer now one quite admission you go and commit suicide or something.
Wow.
Yeah, so based on your score, then the right thing will be done.
So these scores, can we score ourselves, or it has to be the psychologist who scores us?
Oh, you can score it yourself. If you can only be honest with yourself, you can score it yourself. And most of the time, when you score it yourself, people get so anxious. Hey, something's really depressed. So most of the time, you need someone to do it, but you can do it yourself. Yeah.
Well, I think that Doc will share these questionnaires with us so that just score yourself. Be very honest with yourself, because you would have to assess to be able to know what is actually happening with you.
Yes.
And you're better off just assessing and see. Sometimes we overrate ourselves. We think that everything is okay.
Yes.
But really, when we assess ourselves, we realize that there are certain things that we need to watch out for.
Yes.
Yekasa afa ni abrofatu ni din depression. Na Dr. Amayeng ate ase say ediniama bi na enam na ifidie bi wo ho a omutumi eye questions. Utumi bisa wo questions na utumi imwaya wo bemma no ebema ye hu say wo depression anase wo ni bi say wo bi nso a ni grade e serious pa anase wo from anase moderate. We're still discussing depression. We'll take a quick break. This is the health arena, and we are discussing depression. Doc, before we went on the break, we looked at the assessment, and you are kind enough to share it with us. If you do the assessment and you know the scoring that came, please, Doc's number will be on the screen at the end. Please feel free to contact us if you need any help. So after assessing ourselves, okay, how does depression affect us? Does it affect us in any way? It's just something that happens to our mood. But does it have any other effect on us?
Yes, depression has a lot of effect on us. First, it affects the way you think. So it means when you go to depression, you don't think properly. You don't think rationally. Because all the you are going to a different state of your total being. And it affects the way you behave. The least provocation, no bofu. The least thing, you might start crying because of the depression that you are going through. So it affects the way you think, your behavior, and even the way you act in your environment. It also affects your sleep patterns because you can't sleep. And we know that if you don't have good sleep, it means that the energy that you need as a human being would be compromised and affected. And most of the time too, people who also have depression, they have headaches. They may be having headaches and they may be having back pains and joint pains because they are not having good sleep. They don't feel rested enough. So they have all these symptoms. And it's even research has shown that it can even affect their digestive system. So depression, we have constipation, diarrhea. Yes, it affects all these things. And you see, when you are going through depression like that, it can even elevate your blood levels. So people who have hypertension, who have diabetes, and all these things, we tried that they wouldn't go out of depression. Because depression now can cause stress. Because you're always thinking, and you know what stress leads to. Because when you're going through stress, there's this hormone, we call it cortisol. It's released by the adrenal gland. And this cortisol, the moment it is released, it can affect you. So depression, the idea we should fight against it as human beings. Yes.
It doesn't only affect your mood, but even the way you do things, your body, your thoughts,
your physical health and everything. It affects every aspect of your body.
Nti ebi a wo obi saa o anasa wankasa wo fa bibi mu saa a wonti ase enche na wusu enche na wo re aho wo soma wo kremu saa wo jemu ene ye ti ase se bibi wo ha ye fe ni depression ebi a na nya wo fe mu no eye bia emo wo ho na mfa nhye wo ho yesu akọ na ye pensem more things are coming up. But Senyayaka so far affectewa yesewara. Let's get the appropriate help. What causes depression?
Okay, thank you very much. In fact, depression, a lot of things may cause depression. First of all is abuse. Obi he has been abused physically or sexually or emotionally. And that incident, is on his mind. Instead, we are not all jail. Then it's causing that kind of sadness. And now after this, and my baby now after childbirth, you see, we are most of the time there should be joy. But as a woman they give birth and later they go through that depression, and it occurs within the first 3 months after childbirth. You see, when the woman is pregnant, there are two hormones, estrogens and progesterones. It goes up, but these hormones decreases. It is about phenomenal. Some women start to have those depressive symptoms. I know a patient, already patient, through depression, he wanted to kill the child. He put the child in an oven. Yeah, there's another woman too. He didn't even want to breastfeed the child because of the depression that she was going through. And another form is also life issues. But it could be unemployment issues, marital issues, money, sika. People have so many bills that they can't foot. All these things may cause depression. And even some people too have health problems. Maybe they've been diagnosed of chronic illnesses like hypertension or diabetes or cancer. And the thought alone, see, hey, a problem we know may cause depression. Before I came to this show, about a month ago, there was a man who was telling me that he was going through depression because he's about to go on pension. So he's scared of life after pension.
After pension.
That people go through pension and their life becomes miserable. And he's now a manager. So all Kofi, he's going home as what? Just going to the house like that. So it's going on pension, a blessing to him or otherwise. And he was going through a lot. To the extent that the least provocation between him and the wife, near the assembly braba. And he's 59, I'm not pension next year. So you see, that form of depression, even life after pension is causing the depression. Another thing is also that I've seen is genetics. Some people know depression, it runs through their family. There was this lady who was, she's 31 years, and she was going through depression. And I interviewed her and I realized that the mother also had an episode of depression. So the depression is running through the family. So if with depression is something genetic, there's something called diffuse stress model. The moment something triggers it, now you go to that state. So depression, a lot of things may cause depression. And there's something interesting. What will cause depression in one person may not cause depression in another person.
So what would make somebody more susceptible to being depressed by the same thing than another person?
Okay, yeah, that's another good question. It's sometimes our coping mechanisms and our coping skills and the way we interpret and appraise life situations. Yeah, some people have positive attitude towards life. So whatever happens to them, they see that, there's always light at the end of the tunnel. Some people too, they think that there's no tomorrow. Everything ends today. There's nothing like a bright day. So that thing may cause a lot of people going through depression. And even death. People lose their spouses. People lose their children. And they can't take the shock. And this thing may cause them depression. Yes.
Wow. We will come to the management. So does it make a difference? Do you see when it comes to religion, Christianity and depression? Does our faith play any role in who gets depressed and who doesn't get depressed?
Okay, yes. So in terms of depression, as I said about coping, if you are very religious or very spiritual, sometimes it helps. Because you see, you use the word of God in whatever situation you find yourself.
Yeah.
The word of God will speak to you and you encourage yourself. And even if you are going through depression and you are watching our program right now, at least you get some kind of knowledge. You go to church, you go to Imelco. I like the way you are wearing your Imelco cloth.
76, we are on.
Yeah, you go to dance movement, you go to youth ministry, you go to this, you sing songs, you meet friends, so it helps. So people who are into religious activities, most of them may be able to manage their depression than those who decide that, I'll just be at home and just be thinking and thinking.
Inti say we call asori no yeso nyame yetie onyankopon asem but eno so eboan ye ma yare bi no mu a ye keka ho asem no say ufa ni serious a enter because eba wo bibia wo betumi ejina so say yasimun sem or how abrabumun sem eba wo yidi ni a wo say wa yehye mu nipa ko a ebo wo ban ewade enti eno brow to cope with some of these things.
Yes.
Now what can you me pese wo san ekoho kakra ye kamia edi depression ne ba no. Now we can about ema enwu a ebinum enya depression. Now we church mu what eden na ema binum no omo a eyesa no.
Okay, enti your friend postpartum depression. Now it's something that is very, very common. Now it's even linked to postpartum psychosis. I don't know a lot of women who are mad. A lot of women are currently treating and they're having mental problems. Maybe it will be another topic for discussion. and also the postpartum depression. No? But you see, a lot of changes occurs in when a woman is pregnant. And when a woman is pregnant and unya support from whether the husband or the family already know she is in that state of low mood. And unya na unya that support and that joy now. Ubona depression no started boom. Especially even if the lady was raped or the husband decided not to take the pregnancy or whoever got her pregnant decided not to take the pregnancy. There was this woman who was going through depression, and this is what happened to her. Not our girl was 5. No, our girl was 4. Okay. And not a boy back. And the doctor didn't tell her because of the anxieties that she had. And so girl. Another girl. And she became so depressed. To the extent that it was even affecting the breast milk that was coming up. And the woman was on antidepressants because she was going through severe level of depression. And this the first 3 months, some people can even take up to 1 year. That first 3 months, we realized that sister, you are weary, but we need NJ on Shakolano, on money mufuo, on Jari, on answer on Jari, then they are on Didi. It will say there's something going on somewhere. So most of the time, women who deliver, who say in our Ghanaian culture, most of the time, so about poor who are not cotton mammy chain. As the mother even comes there, but we need that support now. Akrani isu na adwendwen na orje. Even it can even affect the man too, because who's it is about or where the sleep pattern. I remember when my wife gave birth, and I did akwani isu I the buano because this time we crazy, but not so bad. And some people can't adjust to that condition. And another thing also is like that. Maybe me, for instance, I remember when my wife was pregnant, I knew there was a baby in her. So when she delivered, she did CS. I was in the room. I was like, hey. So it was really true there was a baby. I know about it. So they really true there was a baby in you. And you see, some women deliver and they see the baby and they are shocked. So all these things can cause the depression. Yeah.
Enti nyaya kan say sa adewe no eye bibia ene yen ewo ho. Enye bibia ewo echie bebre. Ebia na wo hu obi a owoye chi no utumi say ni neye asesa. Nya yesu ne say enye nipa no na oye bibi anase we dia fe de owoye de o kire bibi o na emom ebetumi aye say yare
depression.
Ebi ho a owoye no onya emwa ema onya mwa enti aka ono nkwa oni akwalai na eye sama eno so etumi de depression eba na no we aye ka ho asem ye nyama ene yen nete yensua na se yehu bibi saa yetumi etuhu anamonpa na yetumi aye ho djuma. I'm just asking, so again, like we asked for the children, these things that we've talked about, we've been looking at adults. Does the same thing happen in children?
Yeah, we have childhood depression, and it's even more serious.
Oh,
yeah, in the children, because you see, if a child is going through depression,
how?
Children also go through depression. You see, in our last week, you can say about mental health, and that makes us even sometimes as parents, and then my catcher can cause them depression. Even in the school environment, teachers can cause depression. Make I say the young colleague school no, the class teacher chair my dear. In fact, or chair my dear from O'Brien, and along the line or create segregation in the classroom. Into those who are good, LE, those who are not good, kakra, LB, CD. And I think the teacher was thinking that those who were in D, encourage you more alcohol A. But the question is, that better make just C, I'll just B, Ababa A. Let me stay at my D.
Wow.
And so those who were in the A, they saw themselves as so intelligent. And those who were in the D, saw themselves that maybe they be a better day. And that alone can affect the child. So akola cause could say it can cause depression. Even even physical abuse among the it can all cause depression.
Depression is real and it is happening. Please stay with us. We'll take a quick break, and when we come back, we'll continue with our depression discussion. Staying with us. This is the health arena, and we are discussing depression. If you just joined us, we've been looking at what depression is, and we've been made to understand that it's a mental health disorder where you have certain symptoms that persist for over 2 weeks. And these are things that affect your mood. Things like you are not able to sleep, or your sleep pattern is affected. Your mood is affected. Your eating habits is affected. Your self-esteem is affected. And these things persist for more than 2 weeks. And there is a way that you can assess these things. There's a tool we just shared, and I'm hoping that I'll be able to share this tool with you again so that you can ask yourself these questions and assess yourself. If you assess yourself and you realize that you are scoring certain figures, you should see a clinical psychologist. And we have one that we are discussing depression with. Doc, so before we went on the break, we were looking at the causes. And so once we know the symptoms, we know the causes. And we know the tools that you use to diagnose or confirm that this person has depression. How do we deal with it? Or how do we manage it when somebody has depression?
Okay, thank you very much. That's a very good question. Before we look at how we deal with it, let me also, based on my experience and my practice as a psychologist, before people are diagnosed, they themselves deal with their own depression before they seek for professional treatment.
Wow.
And most of the time, you know, you're not into most of the time, some people tend to alcohol.
Ooh.
Yeah, they tend to drink a lot of alcohol because they think that alcohol now it will give them some kind of relief. But you see, alcohol will give you a short relief, but the problem is still there. And some people too, they tend to always sleep because they don't find any joy in any activity. So they are always sleeping. And some people too, they tend to overeat or they don't eat at all. And some too, they tend to smoke. I had a patient like that. He was smoking cigarettes because he was going through depression. And some people too, they tend to self-medicate. They go to the pharmacy shop or the drugstore because they can't sleep. Then they buy sleeping tablets.
So that they can take and sleep.
They can take and sleep at night.
Wow.
Because they can't sleep. Yeah, and some people too, they engage themselves in aggressive behaviors to manage their depression. Because the least provocation, not any aggression. Yes, so that he would bring out the emotions that he's going through. There was a patient that I was attending to. She was going through depression, and she was channeling it through sex. Having a lot of sex to get that joy that he was not getting because he was going through depression. And all these things are bad ways of managing. And the more you have sex, you know, it goes with energy. So think we are losing weight and we are losing energy. So all these things are bad ways of managing depression. So let's look at the good way. If you are going through depression, first and foremost, you have to seek for professional help. We have shared the instruments with our viewers. You can score it yourself. So when your level of depression is high to the extremes, we recommend medications. Not everybody who is going through depression is given medication. Some people, just counseling can help. Yes, okay, so start going to church. Start eating very well. Start exercising. That alone will work for the person. But if it's to the extremes, the doctors will recommend medications. And also positive self-talk. Most of the time, when people are going through depression, the first thing is self-blame. They blame themselves. They think that nothing good can come out from them. So you have to change the way you think. Tell yourself that all is well. Christ in me, the hope of glory. All is not lost. Wherever there's a will, there's a way. I will by all means overcome this. And in apostolic, for instance, we have a lot of hymns. You can sing 9 songs, 9 hymns. Do you get it? Yeah, you can sing 9 songs, listen to good music. It will help you come out from the depression, and also exercise regularly. After exercise, dear, is very, very important. You can call your children, your cousins, your grandchild, or whatever it is. Oh, let's go and take a stroll. Let's start jumping. It all helps.
I like that. Call people around you.
Yeah, around you.
You can go for a walk.
For a walk. So even in the church, whenever we're having any keep fit or any health work, please be part of it. Because last year, the youth in our church organized a health work from a bridge junction to Pediase, and we had fun. We enjoyed ourselves. I was like, wow, for a very long time, I've not walked that distance before. And also engage yourself in a hobby. Yes, engage yourself in a hobby. Like maybe you read something, even if you're a lady, you can be cooking. You see, don't put yourself in that corner.
Small corner.
That will cause the depression. You can call friends. Yes, it will help you. And build good social network. Yes, it will help you. And the last thing is, see, sometimes you need energy. You can't sleep and the rest. So there's an exercise that I will show our viewers. When you are going through depression, I've said that sometimes you give medication by the doctor. Sometimes you have to change the way you think. Sometimes even your environment, you have to change your environment. Whoever is causing a depression, you have to change the environment so that you have your peace of mind.
So if I'm understanding you, when these things happen, we don't just leave it, but we deal with them.
Yes.
And so in dealing with them, we can use medication or these alternative means that you have showed us.
Yes.
And depression na ye kano. Say eban say ye kase nyawuye ye kekabo ma eno no depression na ehu eduro wo ho, but eno no enye nia wankasa osori ekọ hospital anasa ukọ pharmacy shop say na say mitumi na enti mama me enedru ana na say mitumi ni papa enti mama edru a me fa metumi edidi na mom e wo say ukọ professional ho a professional a ye hye so be call ni ho a psychologist enti ukọ a onu ankasa betumi akire na we hu say bebi a edru no edru we na wo say wo fa ana say woni nia e wo say wo ye na nia ewe me dey mu ni say eni na na obefa edru
Debbie
enti o ka say e wo say nya a good social network ukwa sorry a we ankonam wonko a ye pon a na wa fa baby ye ba wa sorry dem we nya dan fu bia wa sorry I don't know how do you don't have a social network anyway say asori ye bibia won fa hunji e na mo ye omade debi what's the san e beboa na doctor say exercise bi wo ho a eno no otumi kyerɛw na ɔkyerɛ yɛn a ye betumi aye enti ye be ma na kyerɛ yɛn na ya practice na se bibi saa ye tumi aye e de aboa yɛn ho. So you mentioned that there is a certain exercise that we can do to help us manage depressions, some of them by ourselves. Would you be kind enough to take us through? And viewers, a gentleman has just offered to help us so he doesn't have depression. Those of you who know him, when you see him, don't say that he has depression. He's just showing us the technique.
Okay, thank you very much. And you are welcome to the show. I'm so happy and excited to have you on the show and to volunteer to be used for the exercise. Yeah, so this exercise, when you are doing it, there shouldn't be any weight on you. Do you get it? So I can see you're having a watch, but you can wear the watch. But if you are doing it at home, you have to remove your watch and everything, because already you are going through depression and there's so much weight and heaviness on your heart. Okay, so this exercise, in fact, the chair that you are using itself is very, very hard. Most of the time at the hospital, the chair is a relaxation chair. So as we do it, you'll be able to relax very, very, very well. So you have to first of all stretch your legs. So stretch your legs. So you are wearing a shoe, but when you get home, you have to remove your shoe. Do you get it? Then you put your hand on your chest. Then you put one on the other one on your stomach. Then you close your eyes. So that nothing will distract you. Maybe there's something causing a depression, so that for this period of time, you will not see it. Do you get it? So when I say breathe in, you breathe in deeply, and your stomach must rise so that the air will enter into your stomach. Then you breathe out. So as you breathe in, I'll count 1, 2, 3, 4, 5. Then you breathe out. Do you get it? Then later you will count 1, 2, 3, 4, 5. Then you breathe out. So let's start. So breathe in. 1, 2, 3, 4, 5. Out. Breathe in. 1, 2, 3, 4, 5. Out. For the last time, breathe in. 1, 2, 3, 4, 5. Out. Now you do it yourself. So breathe in, then you count 1, 2, 3, 4, 5. So breathe in.
1, 2, 3, 4, 5.
Out. Breathe in. 1, 2, 3, 4, 5. Out. Last one. Breathe in. 1, 2, 3, 4, 5. Thank you very, very much. So this short exercise that he's done, when you do it, you get energy into your system. And realize that as you are doing 1, 2, 3, 4, 5, your mind is on whatever you are doing. At the hospital, sometimes there's a music at the background. So as you are doing it, the music is also playing, and it is giving you that kind of excitement or that kind of joy. Even most of the time, I ask the patient, what kind of music do you like? Then I'll play for the patient, if it is gospel or whatever it is. Then for that period of time, he is okay. So when you go home, as you've learned the exercise, every time when you feel that you need energy, you are overthinking and the rest, you do the exercise, you breathe in and you breathe out. You breathe in and you breathe out. When you do it for some time, you'll be able to manage whatever is worrying you, and even the stress that you're going through would calm down and you'll be okay.
Enti where bibia emfa ho bibia wo bia ubetumi aye. In fact, all share yen abrantie no me so me try it. So wa relax na wakata weni. Na obuni ekomu pa na wakan 1, 2, 3, 4, 5. Our tobo. Then say we yen 1, 2. In fact, me am say hakrasisi ano. I feel very relaxed.
Yeah.
Enti is it what you call the relaxation exercise?
Yeah, deep breathing exercises. Yeah, so that you breathe in, you breathe out. You breathe in, you breathe out. Whilst you are doing it down, it is relaxing your system. And also for that period of time, let me say, what day would be on whatever you are doing.
Now, Mati Bibi, I friend psychotherapy.
Yes.
Now, and how does that relate to depression?
Okay, so psychotherapy is where we take you to psychological techniques, and one of them is the cognitive behavioral therapy. And in this case, after the assessment, I'll do an assessment on the thoughts, and this is what is causing you the negative thoughts. Then we would try to rechange. I'll try to rechange the thoughts for you. So if you feel that fine, you are useless, you think that nobody likes you, you think that every bad thing is about you, I would help you to change that thought. Yeah, so what he went through is part of the psychotherapy session you go through when you are going through depression. So
since we are Christians, let me throw this in. Bible makes us understand that there was a time in Saul's life, King Saul's life, when he was being tormented, and they called a young man who was skillful to play, and as he played, whatever was tormenting him left him. And so this kind of therapy, does it relate to what we do in your practice?
Yes, so depending on the patient's needs and the issue and what I'll recommend. You know, as I was saying, at the hospital setting, so if you come for a private setting, I have music at the background. So as you are doing the exercise, there's a nice music that is being played. And the music is such that it's contagious, you will sing along. So as you are singing along, you are enjoying it. You realize that for that period of time, you are happy. As you are saying that they were playing a harp or something for the king,
Yeah.
it helped him to come out from whatever problem that he or she may be going through. That's why I said that in depression, you need to even sing happy songs. The more you are singing, your mind is focused on something else, and it is help you to overcome the level of depression that you may be going through.
It is a obi bana say or go through therapy we are. How many times and also how many sessions? And one said oba kuna na problem na ko. And I said it was a koswana oba.
Okay, so for a typical depression case, as a psychologist, you know, it can take like 3 months. I have to meet you for about 8 sessions. Then after the 8 sessions, you know, it will be any other week. Then after like any other week for like a month, it can be every 2 months. Yes. So a typical depression case is for like 8 sessions.
Yeah. We call hospital back we psychologist na just say asa.
No.
But you be was saying you
yeah.
And ya film.
Yeah.
Now another week masaya ba another week masaya ba. It's one say now hospital in Kwana moye surgery and I say it can be done outside the hospital.
Okay, so currently we have a lot of psychologists around. So most of the government hospitals, teaching hospitals, even polyclinics, there are psychologists there or psychiatric departments there. You can go. And there are some psychologists, like in my case, that now I do private practice. I used to work with Ghana Health Service at Cape Coast Teaching Hospital, but now I'm no longer with the Ghana Health Service, so I have my own private things that I do. And about the sessions, you know, most of the time, a typical psychotherapy session is like 45 minutes. So that means you can't exhaust everything. Most of the time, the first session, I don't even start the diagnosis. I just take the history. Because I have to start your history. Even sometimes I even start asking you things as far back when you're in class 1. Even when you're in your mother's womb. Sometimes I call your mother. Was your child through CS? Was he preterm? Was he this? So we do a lot of assessments. So even the first 2 sessions, you know, it's more of just assessment. Then other sessions, you know, we do the test. So after the test, you know, then we look at the type of depression that you are going through. I have a patient for the past 4 months. He's been coming for sessions on depression. Wow. Yeah.
Well, we've been looking at depression and the causes, how it affects your body, and how we can manage depression. We'll take a quick break, and when we come back, we'll have our concluding parts. For staying with us. This is the Health Arena, and we have been looking at depression, which is a mental health disorder. Did you know that depression is so common and about 5% of adults actually go through depression? Discussing this with us is Dr. Jonathan Odame. Doc, so having taken us through how real it is, the signs, the symptoms, how we can assess ourselves, and the treatment modalities available for us, what will be your final words to us?
Okay, what I would say is that depression is treatable and it's preventable. If you are going through depression, please, I want to tell our viewers that there is help. Seek for help. If you know someone going through depression, please help the person to seek for professional help. And we should always have a very positive attitude towards life and have it in mind that no condition is permanent. Christ in the boat, we can smile at the storm. There's always light at the end of the tunnel.
So even though these things happen and they are real, and we don't deny it, there is always a way out.
Yes.
Depression yare eye bibia ampa ewo ho. Eye ema more sing emema na so emema nso eka ho. Na se ye ka yare ho asem ni ye ka ne se ehudru ewo ho. Se nyema aye keken yini mo bi anase wankasa wo fa sa de we ma. When ye bibia wo de hye wo ho a wo kwa wo de hye dem. Now so emwa wo ho. You can reach out to us. You can reach out to us on the numbers on our screen, and we would advise you as to how to go about it. But otherwise, you can go to a nearby hospital. If you realize that your mood has changed, your eating habit has changed, your sleeping. As for the sleep, I know it will catch a lot of people. A lot of us are struggling to sleep. But all in all, Christ is the answer. The word of God is available unto us. Church is available unto us to use the network that we have. Let's sing. Let's speak the word of God over our lives. And even if depression exists, God's word is powerful and can heal us and use the avenues that are around. This has been the Health Arena. And I want to say a special thank you to the Women's Movement of the Apostolic Church. The leadership graciously has dressed me up today. God bless you so much. If you want to sponsor our program, our numbers are on the screen. Also, you can use these numbers for enquiries, for questions, for comments, for contribution. Lady Kesua Note, thank you so much for my beads and my earrings. God richly bless you. Let's continue to learn on the Health Arena. And as God gives us grace, we'll bring you another episode in the near time to come. My name is Helen Tettey, and I have been your host.